This patient, I think you can make out this is a patient of stasis eczema, right? He is having even well-defined varicose veins also, but because of the swelling which are not that visible. You can see now it was a diagnosed case of stasis eczema. It came to me, and I planned the treatment accordingly as per my assessment of this. Like stasis eczema, etiology is stasis, and varicose veins, and clinical diagnosis it was Vicharchika. So I treated it with Vicharchika Hara and like Vishagna Chikitsa, like I always do. So in just 15 days, you can see this is the outcome. Patient developed, reached this stage. We were able to manage, bring this stage to this within 15 days, right? Just in 15 days, it was possible. But what happened on this day when he came for the follow up on the 15th day? He complained of pain, dryness, and stiffness. Here, he complained of pain that is due to increased dryness and tightening of the skin, stiffness of the skin, right? He complained of pain. Now I thought this condition is dryness is increased. Maybe because of that the patient is having more pain. So I need to give some action application like snigdha chikitsa. So I prescribed Manjishta Thaira for action application. When we look into this condition broadly, Manjishta Thaira is very much suitable, right? Kushtagna is also there. It is Kushtagna also. Vata dominant presentation is there. Dryness is there. So I thought it will be good and I prescribed it. You see, just 5 days later, patient came back. Within 5 days, again condition got aggravated to such an extent that it was more than what it was on the day one. It increased even more than what it was on the first visit, day one, right? Now I changed the external therapies, right? I changed the external treatment, and again next after 15 days, you can see it became completely healed now. Even dryness is also gone. Discoloration is there that stays for long time, right? Again, just 15 days. Only change that was made was the external application. Internal application was same exactly what was given in the beginning, like that it was done, and external application changed and able to reach back to this stage, right? Now, what went wrong here? What went wrong? Why a condition which was which reached this stage almost no, there is no, I think not almost, completely nil secretions and all, completely dry. And all of a sudden, just in just 5 days, it became like this. What went wrong? Namaste. Welcome to Dr. Mahesh speaking. Myself, Dr. Mahesh Savalagimath. I am practicing Ayurveda Dermatology and teaching Ayurveda since 2008. And welcome to my channel, Dr. Mahesh speaking. And as we are discussing the dermatological strategies, particularly Ayurvedic principles, right? Ayurvedic dermatology strategies we are discussing. So today in this session, we are going to discuss about some of the very important principles of Bahir Parimarjan Chikitsa. I may not go into all the details, but I will be trying to give you some insights when we are planning something for external applications, like whether it is oil application or something like that. But we will be going with not with oil. Oil we will discuss in some other session, right? So today we are going to discuss about external Bahir Parimarjan therapies, particularly with Lepa, Seka and all, not oil application. How to select them? What is the principle behind that? How to choose a correct external application and all? It is very simple. It's very simple, very effective. It's very simple and very effective. Just we need to have a focused observation. It requires just a focused observation. So it is very simple, right? How we need to improve our observation, that we are going to discuss with examples, right? We'll see some examples. Very important is whenever we think of a presentation, we there is explanation about the avasthas, how the condition is presenting, and most often we consider these avasthas when it comes to like abscess, something like that, arbuda or something like that, or vidradi, that type of conditions only we consider avastha. But it is very important to consider in all the dermatological manifestations. As you all know, there are three avasthas: Ama Avastha, Pacchamana Avastha, and Pakwa Avastha. Right? So, how to select when the condition is in Ama Avastha, when it is in Pacchamana Avastha, when it is in Pakwa Avastha? If we are able to assess that avastha and if we are able to select right medicines, external applications particularly, then we can get better outcomes. We can get better results and there will be no complications at all. Right? Now, if the condition is in Ama Avastha, what is to be done? We need to select such external applications which are going to improve Paka, which are going to induce Paka, not improve. They are going to induce, they are going to set in the Paka. Condition is in Ama Avastha, so we need to use such medicines, external therapies particularly, which will induce Paka. So Paka will start. If it is in Pacchamana Avastha, means already Paka is taking place, but it is delaying. Because of that, patient is developing pain and all. So at that time, we need to give some external applications or external therapies which are going to help the Paka. Right? Paka is taking place, it has set in, but it's not that fast or something like that. So we need to give some medicines which are going to increase that Paka so that it can completely get Paka and then it can be cleaned correctly. Right? When we get the patients in Pakwa Avastha or when the condition is in Pakwa Avastha, at that time we need to give something like what we can call Shodhana Dravyas, Pruna Shodhana, like that. Okay, we need to give something which is going to clear the Paka or which is going to clear the outcome of Paka. Like there is Paka, there is secretion. So we need to give some external therapies which are going to clear that, right? So when it comes to Ama Avastha and Pacchamana Avastha, we can go with Lepas, right? We can go with Lepas. But when it comes to Pakwa Avastha, at that time, Lepas are not recommended. We need to go with Seka, pouring of decoctions, right? Washing is recommended. So, Ama Avastha, Pacchamana Avastha, we can go with Lepa. When it comes to Pakwa Avastha, at that time, we need to go with Seka. So, we will see some examples and we will try to understand some external applications, right? Here, whatever I am going to discuss, these are, you take them as a reference or what you can call examples. You need to understand why these particular external applications are selected. You need to understand the principles behind that, how they are going to work. So if you may not get similar kind of presentation, if some other presentation is there, at that time you should be able to apply that knowledge. If you have understood why we are selecting particular external application, if you know that reason, then you can select very suitably the medicines external applications. You can select with more suitability and you will get better outcomes. Okay, and you all know, I think you can diagnose this. It is ajagalika as per Ayurveda and it is as per the modern, it is molluscum contagious, right? Both usually seen in balanam ajagalika, it is said, but even in adults also we can see. Now we can see how these are lesions. Lesions are very hard. We can consider them as in 100% Ama Avastha. They are in completely Ama Avastha. We will consider them. So if the condition is in, I am giving example, right? So if condition is in Ama Avastha, what should be done? We should use external applications which are going to induce Paka. They are going to induce Paka. For example, we need to go with Tikshna Lepas. We need to go with Tikshna Lepas. Here, we will take example of Kshara application. Now, Kshara application is also used to induce Paka, right? It induces Paka and it even completely clears the thing, right? So we have to use when Tikshna Lepas. You can take many like Chitraka Lepa and all, but suitable to the condition. In this condition, Kshara is suitable, which I use practically. So I'm giving example of Kshara as a Tikshna Lepa application in Ama Avastha, right? So Ama Avastha of a condition from one disease to another disease is also different, right? So at that time, Tikshna means in some maybe Chitraka, in some it may be Kshara application, or in some it can be like Searcher application, or it varies, right? Condition to condition, it varies. I will explain you one very important shloka later. So you will understand how it should be selected. So we have to choose Kshara Lipi here, for example. So you can see this is Ajagalika before and this is during the treatment. After this follow-up, patient has not come. Here also you can see before and this is after completion of the treatment. What I did, I gave Yavakshara, Haridra and Vilvadi. Right? Yavakshara, Haridra, Vilvadi. This is Vilvadi. In market is available as Vilvadi Gulika. So this. So as Tikshna Ama Avastha is there, we needed Tikshna Lepa. So as it is infection, so Bilwadi is very good for infection. So that is why I added Bilwadi. Now Haridra is also, when it is used in Ama Avastha, it can induce Paka. Right? So I intentionally I took this example. I practically used this only, Avakshara, Haridra and Bilwadi. Now why I am taking this? Because Haridra independently can become a choice of drug for external application in external application for Ama condition if the context is different. For example, there is Mukadushita. So there Ama Pidakas, Haridra is okay because that is for that Mukadushika, acne, hard Pidakas, Haridra is enough to induce Paka, right? So in this condition, as we needed Tikshna Aushadhi, so we took Yavakshara, Haridra and Bilwadegada. Bilwadegada again, it contains Ajamutra and all. So again, it is also Tikshna. And simultaneously it is antiviral, antimicrobial like that. So Krimigna, like Bhutagna it is said. So that is why I select this. So when Ama Avastha is condition is in Ama Avastha, at that time we need to choose Tikshna Lepas. You can see now there are multiple abscesses on just to only on right leg he had. History, there was not any revealing like, he's, I think, 76, 78 age and he was not remembering. He was having these multiple abscesses. These all are, right leg only. This is the zoomed in one, right, on the opposite side, this opposite side of this. So you can see it is in Pacchamana Avastha, right? It is in Pacchamana Avastha. Some of the Pidikas abscesses have break open also, means extended Pacchamana we can say. It is not just started Pacchamana Avastha, it is almost going into the Pakwa Avastha, that stage, right? So in Pacchamana Avastha, what should be used? We need to use something which is going to help the Paka. Paka is already set in. We need to use something which is going to help that Paka. So usually Paka Vardaka, Shodhana and Ropana. That type of drugs should be selected. Pakavardhaka should be there and simultaneously they should have Shodhana and Ropana properties. Best suitable for such conditions is Aragvada Patralepa, right? Aragvada Patralepa. So when this patient, you can see I have put only the zoomed in image only. You can see here, I have used Aragvada and Nimba Patralepa. Not only Aragvada, I added Nimba. Why? Because I am telling you that this is a kind of extended Pachamana, nearing to Paka. So at that time, Pakwa Avastha, Nimba can be suitable. So that is why Aragvada and Nimba Patra Lepa it was given. Just in 10 days, you can see the patient became completely free from those lesions. I have given internal medicines also. See, don't take like only external medicines are given. No, internal medicines also given. So YouTube is having some what you can call community guidance. We should not discuss medicines more. And the medicines, I think if you have gone through, I think that section will be coming like how to select the Shamana Ushadis. I think in the Samprapti also how to select medicines I have explained. So in this, along with internal, here I am discussing only external therapies, right? So in this patient, I gave Aragvada and Nimbapatra Lepa. And this is just a 1 day Lepa application image. And this is the outcome after 10 days, right? So when the condition is in Pacchamana Avastha, at that time we need to select such drugs which are going to which are going to enhance Paka, which are going to help the Paka, right? It is extended Paka Avastha, Pacchamana Avastha, so I added Nimba also. Now you can see it is Pakwa Avastha, right? Here it is, there are no pidikas, all are break open, oozing is there. Patient has not applied any oilier. You can see whatever oiliness or stickiness or oozing and all you are seeing, it is just the secretions of the lesions, right? Paduka Visha as per Ayurveda. You can consider in modern allergic footwear dermatitis, no problem. So this is in Pakwa Avastha. So when the condition is in Pakwa Avastha, at that time we need to give something which can clean the Paka or which can clean the results of Paka. Like for example, Paka has taken place, there is oozing. So that oozing should be cleaned and simultaneously it should help for healing now, right? So what should be there? Shodhana and Ropana type of Seka is to be used, not Lepa. You need to use Seka, not Lepa. Shodhana and Ropana. Commonly, very commonly, everywhere available, Trifla, Panchavalkala, Lodrisivir. Trifla you can go in all types of conditions. If any of these two are not available, or Kapha Pitta type of presentation, you can go with this. Little more Kapha also, no problem. To Trifla you can add Aragvada Tok also you can add and then make the Kasha and use. When more pitta is there, at that time you can go with Panchavalkala. If it is Kita Vishajanya, like Luta Visha and all, then there is oozing and all. Vishajanya is there, then you can go with Dodrisavadi, right? These all are used as Kashaya should be prepared and it is used for Seka, right? So when the condition is in Pakwa. Now you can see just 17 days treatment. In this patient, actually I used both Lodrisavadi and Tripla. So Lodrisavadi, I had a little bit Lodrisavadi was remaining. So I started with that. So it lasted for some 8 or 9 days. Once the Lodrisavadi was over, then I replaced that with the Trifla Kashaya. You can see just say internal medicine is also there. I'm telling along with the internal. Only here we are discussing how to select external therapies, right? So Pakwa Avastha, we need Shodhana, Ropana type of drugs. So that is what was used in this patient. I'll give some examples. Like, here you can see more Kleda. I was telling you Kapha, Pitta type of presentation. This is before and this is just after 3 days. What was given? In this patient, literally, I have not given any internal medicine. Actually, I wanted to tell my students how effective or right selection of external therapies also are very effective. So this was given on I think Thursday maybe or Wednesday. Wednesday, my OPD day. It was given on Wednesday. Patient applied, started using on Wednesday evening, Thursday and Friday, and Saturday morning patient washed. And Saturday afternoon patient came to OPD. So overall 3 days, right? Means 6 applications, 6 times washing with the Triflacasha alone, right? Here also, this was the IPD patient. I told you, Kapha Pitta type of presentation. Triflacasha Seka, you can see how hard, dry it has become. Actually, I should have stopped it on third or fourth day itself. Fourth day would have been the better one. Again, fifth day also it was. Now it is become more dry, right? So when Kapha Pitta type of presentation, Trifla is very good, right? When more Pitta is there, at that time, we can go with Panchaval. Now you can see in this patient, hmm, I think I have shown this image in one of the video. There, I have told that these crustings are not vata prakopa. These are due to environmental air exposure. Because of that, they are dried. And here you can see that yellow secretions, pakwa, completely pakwa, right? So I told you pitta pradhana this is. Puya pradhana, pitta pradhana. So now panchavalkala is very effective. 9 days you can see. 9 days continuous daily twice a day. It was here staining and all you can see that it is pitta dominant, right? Pak is there, pitta dominant. So Panchavalkala Seka was done, and this is the outcome after 9 days, right? Outcome after 9 days. All these, whatever I am telling, can be understood by just one sloka, which you might have read or may not have. This is from Kalpasthana, Sushita Kalpasthana. I belong to Agatantra, so I am trying to give example from there only. There is one condition, like there are so many conditions, like Acharya Sushita has explained contact poisoning, Padaka Visha, Varna Visha, Vastra Visha, all those things. So like that, there is one Visha, Avalekhana Visha. Avalekhana Visha means Avalekana is comb. Like in ancient time, even combs used to be poisoned to harm the user. Intention may be jealous with the jealous, so that disfigurement. Okay, so what happens if a person uses contaminated foam? Then what will be there? That is what is this? Okay. Now what happens if a person uses a contaminated foam? Keshashatah shirodhukam kebhyascha rudragam. Granthi janma uttamangeshu vishajushte avalekana. So if a person uses visha lipta or avalekana foam that is contaminated with visha or pasted with visha, then what will be there? Kesha Shata, there will be hair fall, Shirodukka, headache, Kebescha Rudragamaha, bleeding from the Kebe matlab here, don't take like oral and all. Here you can take Romakupa. They are also the Sukshma Srutas. Granthi Janma Uttamangeshu. There will be Granthi Utpatti on the scalp. Uttamanga is scalp, head. Right? These are the clinical presentations. When we look into this, this is a broad presentation. And these presentations can vary depending on the type of the poison. Right? If it is more pitta, then the presentation will be different. If it is more kaphakara, presentation will be different. If it is vatakara, the presentation will be different. But they will be having these lesions. Like granthi, like pidakas are there. If it is more vata, how it will be? Very fine, very less granthis may be there. Or pidakas may be there. If it is more pitta, very quick in onset and they burst open, more paka, early paka. If it is kapha associated, then it takes more time, right? They will be more hard and more time. So based on these presentations, Acharya Sushruta Acharya has explained multiple external applications here, right? We'll see them. So what first one is Pralepo Baushastatra Bhavita Krishnamritika Rishyapitta Grita Shama Palindi Tandulika. So what is the base is Krishnamritika, right? Like you can consider it as Valmika and hill soil, black and hill soil or any black soil. So this black soil should be processed or given bhavana with what? Rishyapita, Grita, Shama, Palindi. Shama is Trivrut, Palindi is Priyami. or Shama is Prengu, Palindi is little confusion, and Tandulika. So the liquid, Grita and Rishapita will be in liquid form, Palindi, Trivrit, and Tandulika Swaras should be taken, and these liquid should be added into the Krishnamritika, and that is grounded, and paste is prepared, and that is applied. Right? This is one. Next, what he says, you can process or give bhavana of to the Krishnamritika with Gomaya Rasa, that is squeezed, no, watery part, like rasa from the fresh cow dung. Right? From fresh cow dung, we have to squeeze it and we have to take the rasa of that, and that should be used for processing that Krishnamritika, and then it should be pasted. This is one. Next one, there is Gomay Raso Vapi, Hitova Malati Rasa. Malati is Jasminum grandiflora, maybe grandiflora. So leaves. Malati Swarasa means Malati Patra, jasmine plant leaves should be crushed, and Swarasa of that should be taken, and that should be used for processing the Krishnamurti, and it should be applied. Or what we can do? Mushika Parnyava, Rasova, Raso Mushika Parnyava. Mushika Parnya is Danti, Dravanti, and all. So the swaras of those can be used for processing the Krishnamritika and application. If Krishnamritika is not available, black soil is not available, then you can go with Agaraduma. Agaraduma matlab Grahaduma. Grahaduma matlab suit that can be used. Maybe Acharya is telling about a kind of what you can call nanoparticles type application. Okay, we'll leave these Krishnamritika and Agaraduma, which is base, which is going to be base. Now, when you look into this Rishapitta, Grita, Shama, Palindi, Tanduliyaka, Gomayasvarasa, Malatirasa, Mushikapit, what you make out? I have given a hint there. I have given hint in this Sloka image. You are able to understand that hint. Rishapitta, Grita, Shama, Palindi, Tanduliyaka, I have given it green. Means this is Saumya, Pittahara. This is very Saumya, Pittahara. Right? I have made Gomayarasa little yellowish. Means compared to Vishwapitta Grita Shama Palindi Tanduliyaka, this is compared to Tikshna. Compared to that, it is little Tikshna. Right? When we go to Malatirasa, I have made it orange. Means this Malatirasa is still Tikshna than Gomayarasa. Then I have made Mushikaparni, that is Danti Dravanti, red. Means it is still Tikshna than Malatirasa. Right? So in just one quotation, one condition treatment, Acharya has explained how many? 4 external applications, and has given a lesson for life, right? So I actually use this same principle for treating alopecia areata, tinea capitis, and all, right? So, like for example, if it is not that severe, like if I feel that there is no need of more irritation and all, then I can go with just hair fall is there, you can go with Propondarica Taila. If you feel there is need for little bit Tikshna, you can go with Durdur Patradi, Gomez Rasa. If you want still Tikshna, you can go with Malatyadi Taila, Malati Rasa. Okay. Still want more Tikshna, what we do? We mix Jaipala with the Durdur Patradi Taila or Malati Rasa, Malatyadi Taila, and apply. Right? So, assessment of the condition plays very important role while selecting the medicines, external application particularly. Right? I think hope you understood this, and if you want, just refer Sri Samhita and read this quotation once again, and try to implement in your clinical practice and in your studies. Okay, so what went wrong? What went wrong here? Can you make out now? This condition was dry, painful. But one thing I forgot, when you look into this, I think I should have added a zoomed in photo. This part shows granular dryness. मतलब दाने दाने है वो, फ्लैट नहीं है, कंप्लीट क्लीन फ्लैट नहीं है, ग्रैन्युलर है. And kushta skin diseases are kleda bahula. So those granular are nothing but that is kleda. So that is when that is where I did mistake. You can see it is a vichachika clinically kapha kleda dominant, right? What I did, I gave manjistadi taila. Manjistadi taila is not kleda hara, though kushtagna, but it is kleda kara and snigdha. It is kleda kara and snigdha. Now you can see this is completely dried. How shiny the skin? It's not granular. It is completely smooth. If you see, it is completely smooth. If you see here, it is rough, granular, means still clay is there. So what mistake I did here? I forgot to assess that condition. I told you no focused observation. I forgot. So I went with Manjista Tela. Practically, it should not be. Maybe Nalpamara Tela would have done better job. So Manjista Tela is Kledakara and Snigdha. So because of that, what happened? Condition got aggravated. Instead of that, I would have gone with Ruksha, Lekana type of oils like Nalpamara Tela. Right? So that is what went wrong with that. Why? That minor mistake, observation, right? So that is why I told you clean or focused observation is very, very important. So what is the take home message? Even if you have seen, even if you have attended hundreds of patients, just don't be casual or don't overlook the presentations, right? We need to be, right? I think it is 2 years back, maybe. Now I'm in 18th year of my dermatology practice. After 16 years of practice, I did that mistake, right? I'm accepting I did that mistake because I overlooked. I should have observed it clearly with the focus, right? Closely I should have observed and recommended the right one. Anyhow, we managed the case. Right? We again brought back to normalcy. No problem. But that should not happen. Every time we should not, it's not necessary that every time we only commit mistake and learn. Now you can learn from my mistake. Right? Okay. So what is very important is take home message. Even if you have attended several patients, but be patient to assess the dosha before you prescribe anything, whether it is internal or external. Internal we have discussed, right? External also it is very important. And whatever I have discussed here, those are just examples. What you need to understand is you need to understand why and how a particular external application should be selected. That is the main intention of this video. Hope you understood this. And if you want to improve your dermatological skills and knowledge and skills and practice Ayurveda dermatology more effectively, then you can join our 50 hours Ayurveda dermatology course. It's a package. 30 hours is on psoriasis and 20 hours is on dermatological manifestations due to Usha. Actual price is more than 10,000 and then on our platform it is fees is 7,000, but only for YouTube Primes. 700 rupees discount is there. You have to use the promo code YT700. Link for this is there in the description. If you still want, like if you feel like that much investment is not there, no problem. I have 3 hours online course also. This is just a small training, but you will learn a lot in this also. It is just 399 rupees. It's on different platforms, ecoayurveda.com, and link for this also is there in the description. So make use of it and improve your knowledge and skills in Ayurveda dermatology. Okay. For more details, you can contact me. And if you feel that this video is worth watching, please like. And if you are new to our channel, please subscribe. And if you have any doubts, any questions, any suggestions, and what you feel about this video, please write in the comments. And please share this video with the people whom you feel maybe it may be useful. Okay, thank you for watching and see you again in next session, next video, one more video. We'll see you again and take care of health. Read and forget, don't forget to read. Thank you. Namaste.